Hi, I'm Dr. Michael Howard from Plano Orthopedic and Sports Medicine. I'm shooting these videos to help you understand how to put the ice machine on after your shoulder surgery. I have two of my great PAs here to help me explain, Tuan and Amanda. Tuan, Amanda, could you help us see how to put the ice machine on after surgery?
For sure. So this is an ice pad that's going to go on afterwards. It helps circulate some cold water. So what Tuan is going to do, we did surgery on his right shoulder. He's just going to have it relaxed as much as possible. This pad has some numbers on it. So 1 is going to go up near Tuan's head as much as possible, kind of folds over the shoulder like this. These pads on the top here have numbers that correspond. So 1 goes with 1. This longest one goes around here. Kind of have to go across the person. And it goes around kind of like a sash. This other pad, we start with number 3, goes underneath the arm. You kind of have to snake it underneath. And it attaches to that number 3. And then the last one, number 2, folds over the bicep like this. Sometimes this number 3 strap is very bothersome to patients. It's in your armpit. And so this third one is optional. If this one is very bothersome, feel free to discard that one. And then this hose connects to the cold therapy unit. And so it is detachable. So when you're sitting down and icing, have this attached to the cold therapy unit. If you're done icing and need to move around, feel free to detach. Sometimes this can leak water, so sometimes patients will wrap a paper towel around it just so it doesn't leak everywhere. It's always very important to make sure you keep something in between the pad and your skin at all times. We don't want your skin to get too irritated because of the icing. So a shirt or a kitchen towel, or when you bring this with you to surgery, you'll wake up with a blue towel underneath it. Either of those will be fine.
Thanks, Tuan. Thanks, Amanda. As you can see, Tuan was really doing a good job of keeping his surgical arm relaxed and comfortable to help prevent any sort of tears from the surgery that we just did. It's really important to protect those repairs after either your shoulder replacement, your labral repair, or your rotator cuff repair. And we can see that with Amanda's help, we were able to get that ice machine on really well. Our primary goal for the ice therapy is to help relieve pain and reduce some of the inflammation. We typically recommend short periods of icing, usually 15 to 30 minutes at a time, with intervals of at least half an hour to an hour in between icing sessions, with no absolute maximum or minimum of times required. Thank you.